Podcast, your trusted source for the latest breakthroughs and insights in cardiology. Here, we uncover the science behind every beat, bringing you cutting-edge research, expert discussions, and innovative approaches to heart health. Whether you're a medical professional, a curious learner, or someone passionate about understanding the heart's complexities, you're in the right place. So let's dive into today's episode and explore the pulse of modern cardiology together.
All right, welcome to another deep dive. Someone sent us some really interesting research, and we're going to take a deep dive into it with you. It's all about how we manage patients after they get a stent, after a PCI.
Right.
And specifically, whether it might be safe to stop aspirin early, like just 1 month after the procedure.
Mm.
Usually patients are on aspirin plus a P2Y12 inhibitor like Ticagrelor, for a whole year, right? We call that DAPT, dual antiplatelet therapy. But of course, you always worry about bleeding with these strong medications. So the big question is, what if we could stop the aspirin early, maybe reduce the risk of bleeding? But, we got to make sure that doesn't increase the chances of another heart problem.
Of course.
So that's what this study is all about. It's called the ULTIMATE-DAPT study. It was published in The Lancet. And I got to say, when I saw these results, I was pretty surprised.
Oh, interesting.
Yeah. So, I think it's important to start by acknowledging that heart disease is still a huge problem, worldwide. And for people who have already had a heart attack, the risk of future problems is even higher, right?
Absolutely.
So let's talk about why DAPT is so important in the first place. Why do we even do it?
Yeah. So, the reason we do it, as you mentioned, heart attacks are unfortunately still really common. And after a PCI, when we put that stent in to open up a blocked artery, that year of DAPT, the aspirin, and the P2Y12 inhibitor, that's kind of the gold standard treatment. It really helps prevent blood clots from forming, right around that newly placed stent. And if a clot forms there, it could lead to another heart attack.
Right, exactly.
But like you're saying, a flip side of that is, we are using two powerful blood thinners. So that, of course, does come with an increased risk of bleeding. It's a balancing act, like you said.
Yeah, a real balancing act. So how did the researchers design this ULTIMATE-DAPT study? How did they figure out if stopping aspirin early was even safe?
Well, they did what's considered, the best kind of research for this kind of question. It's called a randomized placebo-controlled double-blind trial.
Okay.
Which is, that's the gold standard.
Yeah.
What that means is they randomly assign patients to different treatment groups.
Okay.
And neither the patients nor the doctors even know who is receiving which treatment.
Oh, wow.
So it really helps eliminate bias and makes the results much more reliable.
Yeah, that makes a lot of sense. So who were these patients? Where did they come from?
So the study included over 3,400 patients, and they came from a bunch of different countries: China, Pakistan, the UK, Italy. But one really important thing to note is that all of these patients were doing well. After 1 month of DAPT following their PCI, they were all stable and responding well to that initial treatment.
Okay, so at that 1 month mark, they were ready to kind of change things up. What happened next?
Exactly. So at that point, they took all these patients and they randomly divided them into two groups. One group stayed on, both the Ticagrelor and aspirin for the remaining 11 months. The other group stayed on Ticagrelor, but instead of aspirin, they got a placebo.
Oh, wow.
So one group stayed on DAP, for the full year, and the other switched to just Ticagrelor alone.
Okay, so they had these two groups, one on DAPT, one on Ticagrelor alone. What were they looking for specifically? What were they hoping to learn by doing this?
Well, they were really focused on two main things. First, they wanted to see if stopping that aspirin would reduce the risk of serious bleeding.
Yeah.
Where we're talking about bleeding that requires medical attention, not just a little nosebleed or something.
Right. Something serious.
Yeah, exactly. And then the second thing, and this was, really crucial, they needed to make absolutely sure that stopping aspirin didn't increase the risk of major adverse events.
Yeah.
Like heart attacks, strokes, or, even problems with the stent itself.
Right. That makes sense. You want to reduce the bleeding risk, but not if it's going to cause some other problem. So what did they find? Did stopping the aspirin actually make a difference?
The results were actually pretty amazing, I got to say. The group that was taking just that Ticagrelor alone, they had a way lower rate of those serious bleeding events compared to that group that continued on, both the Ticagrelor and the aspirin.
Wow, that's great. But what about the heart attacks and strokes? Did they see any increase in those in the group that stopped aspirin?
That's the remarkable part. They found absolutely no increase in those major adverse events in the ticagrelor only group. So it really seems like, for a good number of patients who were stable after that first month of the TKT, stopping aspirin and continuing with ticagrelor alone could actually be a safer option.
Wow, this really challenges the way we've been doing things, for so long. It could actually change how we treat patients, in the clinic.
Yeah, I think you're right. This study is really kind of a game changer. They actually calculated it out. And for every 48 patients who stopped aspirin early, one serious bleeding event was prevented.
Wow, that's a lot.
That's a pretty significant number. Think about the impact it could have.
Absolutely. And I think the study really, highlights the importance of personalized medicine. This one-size-fits-all approach to, how long we keep people on DATT, maybe it's not the best for every patient.
Yeah, I think that's a great point. Not every patient is the same, and this research really, I think, opens the door for a more personalized approach, a more tailored strategy, really taking into account each person's, individual risk factors and all that.
Yeah. So what kind of factors should doctors be thinking about when they're trying to decide, if it's safe to stop aspirin for a specific patient? Obviously time since the PCI is important, but what else?
That's a great question. There's a few things to think about. Age is definitely one factor. An older patient might be at higher risk for bleeding complications.
Yeah.
Also, anyone with a history of ulcers or, GI bleeding, things like that. Those patients would need to be carefully evaluated, before making any changes.
Yeah, for sure. What about the type of stent that was used? Does that make a difference?
Yeah, actually, the type of stent can definitely play a role. Some stents, they're considered higher risk for developing a clot inside the stent itself. We call that stent thrombosis.
Right.
And, in those cases, a longer duration of DAPT might be necessary. Even if there's a bleeding risk, you got to weigh those risks and benefits.
So it's not as simple as just saying everyone can stop aspirin after a month, right? It's more about figuring out what's best for each individual person.
Exactly. This study provides us with valuable data, but it really highlights the importance of, using good clinical judgment and really personalizing that care. It's really all about having a conversation with your doctor and making the best decision for, your own individual situation.
Right. That's such an important point. It's all about shared decision-making between the patient and the doctor.
I completely agree, and I think this study is just, it's just the beginning. I expect we're going to see a lot more research in this area, which hopefully will lead to even more refined and personalized treatment strategies.
Yeah. It's a really exciting time to be, involved in cardiology, right? We're moving towards these more precise and individualized treatments.
Absolutely.
Which is, great news for patients. So what's the, the key takeaway here for our listener who sent in this research? What do we want them to understand about this study?
Well, I think the main takeaway is, for a lot of patients who were stable after a month of DTAC-ET, after their PCI, continuing with just ticagrelor alone might be just as effective at staying on both ticagrelor and aspirin, but with, a lower risk of that serious bleeding.
It's a big change, right? I mean, for years, we've always said DAPT for a year, that's the gold standard. But now we're seeing that, for some folks, stopping aspirin early might actually be the better choice.
Yeah, I think you're right. It really shows how, research is always moving forward and it's always, leading to better treatments for patients. But, it's important to remember this doesn't mean everyone should stop aspirin early. It's really about having that conversation with your doctor. They can help you weigh the benefits and the risks based on, your specific situation.
Yeah, it's all about personalized care, right? And not one size fits all. This study gives you and your doctor, more to talk about, more to think about. When you're making decisions about your treatment plan.
Absolutely. Don't be afraid to bring this study up with your doctor. Ask questions. Make sure you understand, the reasons behind their recommendations and, work together to make the best decision for your health.
That's such great advice. This has been such a fascinating deep dive. I always learn so much from these conversations. And it's really, amazing to see how research like this can change, the way we approach patient care.
Yeah, it is really exciting to see these advancements in cardiology and, how they're helping us develop, more effective and targeted therapies.
Absolutely. Well, we've reached the end of our deep dive for today, but remember, this is just the beginning. There's always more to learn. Keep that curiosity alive. Thanks for joining us on the deep dive. Until next time, stay curious and stay informed, I do.
Thank you for tuning into the Heartbeat Podcast, where we the science behind every beat. If you enjoyed this episode, don't forget to subscribe to the podcast on your favorite platform to stay updated with our latest discussions and insights. We'd love to hear from you. Share your thoughts, feedback, or questions, and let's continue exploring the pulse of modern cardiology together. Until next time, take care, stay curious, and keep your heart healthy.